Hi, I'm Dr. Eftekhari. I'm one of the partners at Florida Kidney Physicians, and I'm here to talk to you about kidney transplantation. When you have kidney failure, for whatever reason, some may go to dialysis and some may have kidney functions of 15 to 20%, which is very low. The most important part that any nephrologist can do for those patients is to refer them to a transplant center that can help get them evaluated. Having a kidney transplantation is not a new kidney necessarily. It is a kidney that's either cadaveric from a deceased donor, such as someone who was in a traumatic accident but the organs were safe, but had brain injury, for example, or more importantly, someone of your family or friend, a living donor. When I refer patients to the transplant center, I always emphasize how important it is to work up and see the transplant physicians and the surgeons, because it entails several weeks of workup procedures, diagnostic testing to make sure that patient is healthy and able to get a transplant without any heart or other complications. We always educate our patients to try to look for a living donor. It's a touchy subject, I understand. But ask your family members, your friends. You would be surprised how many times I hear heroic stories, even church members. There was a case in Disney World that someone had a transplant shirt on, I need a kidney, and someone gave that kidney to that donor. Ask around and try your best to get a living donor. If that's not attainable, then you will be on the registry list. And average wait, depending on where you live, could be 3 to 5 years, some places more, some places less. Once they go to a transplant center, what they should expect is a long list of exhaustive procedures such as colonoscopy, skin cancer screening, heart screening, diagnostic testing, EKG, all these. If they are able to pass those screenings, then, and if their BMI is less than 40, meaning that they are not obese or overweight, then they are enrolled and enlisted in a program for a cadaveric transplant donor, and the average wait, as we had spent, is usually years. If they have a living donor, things can move very quickly, within a period of months, even sooner. A lot of my patients ask me about blood type. Before, it used to be that your matching donor has to have your blood type, and new technologies have allowed transplant recipients to exchange kidneys, and a lot of the programs are looking into this locally, whereas you give a kidney to someone else who matches your family's kidney, and you'll get a kidney from someone else's family who could not donate to that person, meaning it's a kidney swap. This has changed the whole procedure of how we do transplantation. My role in this whole process is I'm not the surgeon, but I am the one that's going to motivate, educate, and promote. I think that's very important, to promote this in patients who are afflicted with kidney failure and who are living their lives with weak kidneys. There is hope. It is the best, some of the best times are when I hear my patients getting kidney transplanted, and it's very rewarding and a happy thing for me to hear. I work with them side by side. I follow them very closely in my office. I give them pamphlets and I educate them, and I make sure that they are aware of their medications and how to keep that kidney alive. Because some of you may not know, once you get a kidney transplanted, whether it's living donor or a cadaveric who is unrelated or is not a living recipient, you have to take medications for the rest of your life to keep that kidney from rejecting inside your body, because you were not born with that kidney. That was a kidney that was donated in your body. Therefore, we do not want your body to reject that kidney. However, don't be alarmed. A lot of my patients, an overwhelming majority, are able to tolerate these medications, usually 2 to 3 that you have to take over a period of the life of the kidney, and they do well. Cadaveric kidneys can last 10 to 15 years, sometimes longer, depending on how you control your blood pressure, diabetes, and the other conditions that that patient has. So everyone will vary. Living donors will last longer, and it's not unusual to see living donors who basically a family or a non-family member who is living, walking around, gives you a kidney, your chances of having a healthier kidney and living longer with that healthy kidney is much better. So one of the most important aspects of this whole process of referring a patient to kidney transplantation when their kidney is failing is really 3 steps that I see. Step number 1 is getting the family, significant other, or anyone that they live with at home involved and educating them with the patient's permission about the importance of follow-up, meaning follow-up with the transplant center, which has long hours, a lot of exhaustive workup, a lot of trips back and forth to the transplant center for diagnostic imaging and whatnot. So step 1 is family, friends, significant other, spouse, what have you, if they have any. Step number 2 is direct mentorship by the physician and looking at them in the eye and not speaking in a medical term, but explaining to them how important it is to follow up with this process and not to be afraid that they're going to be on medications for the rest of their life, or that they're going to have a surgery with a new kidney inside with anesthesia and all the fears that one person can have of this major surgical procedure, because it's definitely a big surgery and it's definitely a big part of the patient's life. They may have fears, so you motivate, you mentor, you answer the questions, you give them literature, and you become unbiased in your recommendations. And I think that's number 2. And number 3 is post-transplant follow-up and encouragement of keeping their health optimal, meaning their diabetes, if they have blood pressure, whatever condition put them into kidney failure, lupus, a hereditary disease, whatever it be. Because once they get the new kidney, you want to ensure the best function in that kidney. So you want to motivate the patient to make sure they take their medications, to follow closely with you after the transplant, and to educate them on being their best, taking care of their body, whether it's exercise, changing their diets, eating a better heart-healthy diet, whatever it may be, but doing what they can to avoid having a second bout of kidney failure. And I think that's critically important. Either way, we promote them to see a transplant center. They have a lot of questions for us. We help them with that, and we stand by our patients to ensure that they get the very best health care. And that's why I'm a physician at Florida Kidney Physician, and that's why all of my partners will agree that we want the very best for our kidney patients day in and day out. Hi, I'm Dr. Eftekhari. I'm one of the partners at Florida Kidney Physicians, and I'm here to talk to you about kidney transplantation. One of the most important aspects of this whole process of referring a patient to kidney transplantation when their kidney is failing is really 3 steps that I see. Step number 1 is getting the family, significant other, or anyone that they live with at home involved and educating them with the patient's permission about the importance of follow-up. Step number 2 is direct mentorship by the physician and looking at them in the eye and not speaking in a medical term, but explaining to them how important it is to follow up with this process. And number 3 is post-transplant follow-up and encouragement of keeping their health optimal. I'm a physician at Florida Kidney Physician, and we want the very best for our kidney patients day in and day out.